So my name's Arlo Welke. Feel free to call me Arlo. This is the orientation to the House of Delegates. It is this body, the policy-setting body of the TMA, the House of Delegates, that then drives the rest of the organization's efforts. And that includes member services to you, that includes setting policy that our lobbyists carry forward. This drives the entire organization, and it's done not only with your input, but with your vote and consent. And this, I think, is the reason the TMA is not only one of the largest state medical associations. When you look around the country and talk to other members, this is by far and away one of the most effective organizations, state organizations. And when you look at our practice here in Texas, we have some advantages that are just incredible due to the TMA over many other states. So let me just begin. This goes back a number of years. Going back 1853 was when physicians got together to improve the health of all Texans, got together by horse and buggy in those days to create the organization that then became the Texas Medical Association. So we have over 150 years of experience. You are now an alternate or a delegate of one of the 500 voting members of the House of Delegates. So this follows a procedure, but this room, the House of Delegates, will set and guide the organization for the rest of the year. So what is the House of Delegates? Sometimes it's a little confusing. These are physicians, and you are not here representing your own interests. Now, your own interests are part of it, but you are here as an elected member, most of you, from your county medical society. Most of the House is composed of delegations from county medical societies. Now, some of the larger cities have very organized county medical society staff and buildings. We have a huge part of Texas that has, in some cases, very few physicians in the county. They have small, but they come together, smaller county medical associations, but they come together under the caucus, Lone Star Caucus, which used to be called Small Chapter Caucus. So if you are from a county medical society, you have a place to go and to meet other members, but particularly tomorrow morning to debate and consider the issues we will be deliberating on. Now, we are also composed of specialty societies. So specialty societies can be recognized by the House and can send a delegate, but really the delegations, the composition, are elected members from the county medical society. So each one of you, as you become a credentialed delegate, will be representing basically about 100 members. There are some additional members that include the Board of Trustees, past presidents, counselors, the AMA delegation that sit. Most of those are already delegates from their county medical society, so those are in addition. But your role in the House really is twofold. First is to show up interested, but you're here to represent 100 of your colleagues back home. If we keep this organization tied to what our members need and what our patients that we are serving need, that keeps the focus of this organization on not only the health of Texans, but the practitioners and the patients we receive. So there are two roles. You need to show up prepared, bring your issues, and there are ways to get issues we'll talk about here to the House. But you need to show up prepared, understand the issues, how they impact your location, and then deliberate and consider those. But your role is not finished when we leave here. As an elected member from your county medical society, your role goes on. You need to go back and tell our colleagues what you're doing here, why this organization is important. We're here, we have the luxury of being here, at least for some of us, because we have our colleagues back home seeing our patients and covering our practices. But it's our job then to go back and explain this process to them so they understand why this is such a valuable process. In other organizations, my specialty organization, it's the Board of Trustees that makes the policy. In this organization, it's the House of Delegates. So consider you set policy through two different mechanisms. One is any member can bring a resolution, and I just love this process. If you think about it, typing up an idea that's not a whole lot longer than a simple email, convincing a couple of your colleagues at the County Medical Society that it's a good idea, you get it on the agenda, and if it's a good idea, you can convince the rest of your colleagues, or at least half of them, that's a good idea. You can leave tomorrow afternoon and put up your feet, and the organization will be carrying out that policy for the next few years. That's cool. Now, some of what happens is once we pass resolutions, a lot of times the resolutions take thoughtful deliberation. The House has about a half a dozen councils that report to the House. So we have two agendas of business. In terms of the business we do, one are resolutions that are brought forward typically by members through their county medical society. The other is much of this, if it requires deliberation, goes to the council, and so we have councils of science and public health, council on socioeconomics. They deliberate, they come back with reports. When we vote, we will adopt those reports. So considering those reports and providing input to those reports are an important part of your role here. But any deliberative body really has two functions. One is to act on the business, and the other is to elect its leadership. So TMA sets the policy, we decide on resolutions and report, and we elect the leadership. The TMA House of Delegates then follows two different really guiding documents, our bylaws, which tell us what we can and can't do. Now, we will have some rules that guide our elections. You can suspend rules, you can't suspend the law. And then we have a process, parliamentary procedure, and we have the AIP code of standard code of parliamentary procedure. Let me just tell you, I think physicians trip over parliamentary procedure a little bit like we trip over statistics. Statistics is a tool we use. It's very confusing if you have to do the numbers, but fundamentally it gives us very simple principles. Parliamentary procedure is nothing more than a set of framework of how we can conduct 2 days worth of business with 500 voting members in a polite manner. And it's not a whole lot more complicated than recognizing that when you're driving, you see the big octagonal red sign, you know to stop. So parliamentary procedure will become ingrained. You don't really need to worry about the nuances of it, but it allows us to do business in a polite manner and get business done without everybody talking over themselves. So there are several different steps to this. All of you should have at least downloaded off the web or have a hard copy of our handbook for delegates. Now let me just explain. This is over almost a 600-page document when I downloaded the final one. If you go to the website and download this, it's a pretty big file, and it's close to 600 pages, and that will be the current, most up-to-date off the web. So we provide the House of Delegates. That's the transition, turning the material over to the House. There is a supplement that has come out, and there are late documents that have come out. If you go to the web, the current document you download from the web, however, will have all those in a single logical order. But that's just today. Today later this morning, we will have reference committees. The work of the House really occurs this morning in reference committees. The reference committees are there to hear your testimony. And I'll give you a couple caveats about this. But the goal of the reference committee is to take the agenda item, listen to you, the members, talk about why this is important or why this doesn't meet your needs, summarize it in such a manner that tomorrow morning we will come back and their reports really become the business of House tomorrow. So I don't want to disappoint you. Your 600-page document is the starting place. It's the reference committee reports tomorrow morning, which we will be voting on in the House of Delegates. So they're two separate, but really the key place to get your work done, if you've got a passionate issue or if you've got a strong opinion about an issue, it's the reference committee reports that are the place to talk and change the direction of those resolutions. Now, tomorrow morning, most of you should know where you can find a caucus. The larger county medical societies will have their own independent caucus. If you're not a member of the larger city medical societies, you can go to the Lone Star Caucus. They meet at 6:30. This is where those resolutions or reports from the reference committee will be considered. This is where the individual county medical societies will decide if there's an issue that's problematic or an issue that they want to support. And then tomorrow morning, and typically, knock on wood, we're done by noon, but by tomorrow noon, the House will have voted and adopted, not adopted, or referred those orders of business tomorrow morning, and we will all then be able to go to our CME or back home to our family. But it's an incredible process if you think about the amount of material and effort that goes into creating this, but this does guide our organization. Now, in the handbook, as you look at it, there are different sections, and most of these are self-evident. There's a lot of general information. I will point to you, there are in this, there are a bunch of informational reports. If you want to understand our organization, I would encourage you to read not only the informational reports, I would encourage you to at least look at one reference committee and review that, and at least paging through it quickly before you walk into the reference committee. But the entire organization is laid out in these documents. You've got an executive director report telling you what the organization's accomplished. You have reports from the president, from the councils. The material is here in that one document to give you a very broad overview of what our organization is doing for us. So tomorrow, the reference committee reports will be used. There's a flow chart for the business in your handout, but we ultimately have 4 different choices for what we do. So the reference committee will bring a recommendation based upon the testimony they've heard, and then we will either adopt as a group, majority rules, the rights of the minority are respected, adopt, not adopt, refer or amend. Now, we can make changes on the floor, but I would strongly encourage you, if you have a change, make it this morning and make your point heard at the reference committee, because we don't really want to spend a lot of time tomorrow amending and making minor word changes. And let me just tell you, the idea of refer is probably just as important as adopt. Now, if it's something we need to vote down, that's very legitimate, but if we refer it, it gets sent to one of the councils. That council will bring back a report on that topic next year. So if you go into the audit trail, which is also in your House of Delegates manual, the audit trail tells you the report of what the councils have done with that information that was referred to them. So we have councils, and we have, under each council, we have committees, and their reports are there, and the follow-up of what they've done with the material, not only that it was adopted, but the material that was referred to them is there, so you can see what we did last year, and that's in your current handbook. So the motion to refer last year, we adopted a new parliamentary authority, the AIP Standard Code of Parliamentary Procedure. It creates 2 different mechanisms for referral. One of which, in the standard use, if we refer it, it's referred to a council or committee for study and then brought back either with an action recommendation or an informational item. The new standard code allows us to refer it for action. If the issue is important enough, we can't wait till next year to get the report back. We can refer it, for example, to the Board of Trustees for action, and that then delegates to the Board of Trustees to not only decide how they want to address the issue, but then to go ahead and act on it. That's still, that information of what they did will come back in your audit trail that's present in your document. This is an incredible process, and I think you will really get the feel for it at the reference committee. I will tell you, it took me several years of showing up and kind of staggering around lost and wondering why the heck I was spending 2 days in a downstairs room of a hotel, until you really begin the beauty of this process. But there's one key, and I'd encourage each one of you to consider doing this morning. Today in the reference committees, they want to hear from members. Each item of business will be available for discussion. But at some point, the hardest thing to testify is getting up and getting the first words out of your mouth. And here's the way you do it. If you're going to stand up and testify tomorrow at the House, or more importantly today at the reference committee, the first thing you do is identify yourself, Welke, where you're from, Harris County. If you have a conflict of interest, it's nice to say that. So if you're employed by the health system that you're debating, that needs to be declared so everybody in the audience is aware of it. And then really state, it's helpful if you say you're speaking for or against the issue. Now, I hate to say it, I've heard some incredibly eloquent testimony and had no idea whether they were for or against the issue, even though it was very passionate. So if you start off by saying, Welke, Harris County, speaking for this issue, my point I'd like to make is I want to change the wording here, or I have a problem with this, but the merit of this is worthwhile. But if you get over this idea, name, county, or your component body, but your county medical society, if that's who you're representing here, and then when you're speaking for or against, once you get those words out of your mouth, you're on a roll. Usually you can get started, but that's the hardest part I found to make your point. So state whether you're for or against it, state your specifics, summarize your opinion. Tomorrow, if you need to amend, and your caucuses will recognize this, if you need to amend tomorrow, that's the formal meeting of all 500 delegates. We have to project things because it's a big room. You need to submit any changes for tomorrow in writing. The beauty of talking today is you don't have to put it in writing. You stand up and you give your opinion, and you can sit down, and it's the reference committee's role to keep track of what you said and whether you're for or against and the points you made. Now, the House does two things. We act on the business before us. Those are resolutions and reports coming from the councils or committees. The other thing the House, a deliberative body, does is elect its leadership. This is sometimes underestimated, but this is an incredibly important part of your role. And I'm not going to tell you anything particularly surprising here. Every candidate wants to meet you and get to know you. And so I will tell you, the best time to meet every candidate is before the election for two reasons. Number one, once they're elected, they're put to work. Number two, they're no longer running. Today this morning, you will get at least a 2-minute for every candidate. Every candidate will talk to the House for 2 minutes this morning to give their general statement of why they are a candidate. Then I think this is just as important as being here tomorrow morning or in the reference committees this morning or in the House tomorrow morning, is that there is a candidate forum today for an hour and a half this afternoon, and I forget the time, I want to say is it about 12:30? The candidates will be there and we'll have interactive discussion. So our Board of Trustees will have an hour where we'll ask them questions. You'll hear their response. You'll get to hear their opinions on things. Our AMA delegates will have 30 minutes afterwards where they will have questions. We'll take some submitted questions from the audience. But it's your job, this is important as voting, your job to know who we're electing and to be there. But I'd strongly encourage you to walk up, meet the candidates, say hi to them, because I will tell you, even if they're not elected, if they've invested enough in the effort to run, they're not going away. They will be here typically for years. And to me, one of the beauties of this process not only is deciding the direction of the organization. I have friends I've known for 30 years from working through difficult problems, but you know what? We have worked through some of the most difficult problems our specialty or our profession has dealt with, and you begin to walk in after the first few years and realize you're among friends, and not only friends, but people you've known and worked through difficult issues with. So make sure as much as possible, I realize it's a little late, look at your House of Delegates handbook. Please make sure you're in the conference room. Show up not only for the House session this morning, for the reference committee this morning, and for the candidate forum early afternoon. And the reference committee reports typically do not come out until fairly late, usually after about midnight. So you may want to pick them up tomorrow morning, but they will have them at your caucus meetings. So as I mentioned, the House of Delegates, after we meet, staff prepares a summary, action items are referred, all these come back to us in the audit trail. We have tracking documents that will report back, but there is this summary from last year is in your handbook. All adopted items are assigned to a TMA component. Again, that's a council or committee typically. But there are other issues. We can send it forward to the AMA. If it's a national issue, our delegation, by adopting it, our delegation of the AMA can speak on behalf of our 50,000 members to the AMA House of Delegates. This drives our policy setting body, and I'd encourage you, the other part of this process is to become or show up at First Tuesday during our legislative session, but this is what directs our legislative efforts. This is where we develop some of our educational programs for members. This is where we then begin study special issues or lobby and address issues with regulation in the state. So this is the fundamental process, and you are right in the midst of it. So again, this doesn't take more than an idea of something that our organization can do. Write it up in the form of a resolution. Convince your few members at your county medical society to get the county medical society to submit it, and bring it to the House. If it's adopted, it can become policy through the House of Delegates, and it can guide the entire organizational effort through the coming year. So the impact of this, we have policy statements, we have statewide and community-wide initiatives. There are campaigns for public education. I know we have one preventive medicine specialist here, but this is where we get these issues out. This drives our state and federal legislation and our lobbying policies. There are policies that have been adopted are on the website. We have created a relatively recently in the last year or two a much better search engine. So typically you can go to the TMA website, go to the policy, type in your policy, and very quickly, I've been impressed how quickly you can find what our stand is. But this is what our staff, our lobbyists, our paid political consultants use to guide their positions on when they're speaking to powers of authority. So they're maintained for 10 years. You will also see they get regularly reviewed, and in your handbook we will have some that are going to be deleted, some that they're going to amend, some that will be retained for another 10 years. That's part of the process. So it's on the TMA policy compendium is there. I'm not going to get so much in the tips of writing resolution. There is a format for that. There are resolves or whereases and resolves. Let me just remind you though, what the House adopts with a resolution has nothing to do with the whereases. The whereases are really there to tell you why the resolves are important. The adoption is only the resolved. So if you're scanning through things, you can very quickly go through each resolution, just look down at the resolved. That's what we will really be debating. The whereases is merely background information. So there are things we can do, adopt as a policy. That's a policy of the organization. Urge Congress, which is a directive to our lobby staff and our professional government affairs staff, or take it to the AMA to the national level. But by doing it through the House, those delegates speak on behalf of the Texas delegation, our 50,000 members. And believe me, at the AMA, even though AMA has not necessarily been very popular with a large number of Texas physicians, the AMA is still the voice physicians have, and it is by far and away the most powerful voice in DC representing physicians. So when the feds pass legislation we don't like, it's the AMA, and they have done this with the repeal of the SGR. It's the AMA's voice that guides the change. So again, let me just finish here. The House of Delegates, the handbook is there. HOD is for House of Delegates. You can download the handbook. You can search our policy compendium. It's there, relatively accessible. Just so you're aware, I am the vice speaker. Dr. Susan Strake from Wichita Falls is the speaker, and she will be presiding this morning. Again, welcome. This is an incredible process. I hope you get engaged, because once you get engaged with this process, it's something that may be confusing today, but it's something I believe you will want to come back and participate in.